Announced he's stepping away from acting because of a serious brain condition. The star says he's suffering from aphasia, which can affect a person's ability to speak and understand language. The 67-year-old announced that he will take a break from acting, but it's unclear for how long. We don't have any specifics on Willis's situation, but aphasia typically occurs after a head injury or stroke. Joining us to talk more about the medical condition is Dr. Mark Alberts. He's the chief of neurology at Hartford Hospital. Dr. Alberts, thank you so much for being with us.
Good afternoon, Aaron. Happy to be here.
So I must admit, aphasia is something that I had never heard of before Bruce Willis announced this morning that he was suffering with this. How common of an illness is this?
Yeah, it usually is not by itself. It's an illness or it's a symptom of another disease process. We can see it with strokes. We can see it with a brain tumor. We can see it after some head injury like a car accident. But it is fairly common with people with degenerative diseases such as Alzheimer's disease and related conditions like that.
Is this something, doctor, that would come on quickly, or is this something that maybe has progressed slowly and that he's been dealing with for quite some time?
Yeah, so in his case, we don't have any evidence that he has had a recent stroke or a car accident, so I suspect that this has been gradually progressive over a number of months, maybe even years.
What's the best for anyone who is suffering with this? What's the best course of treatment? What's the best course of action for them to take?
Right, that's a great question. It really depends on the underlying cause. If it's due to a stroke, these things can sometimes get better. Same thing with a head injury. If it's due to a degenerative condition such as Alzheimer's, there are some medications we can try. We can try speech therapy, but unfortunately in some of these cases it does tend to be slowly progressive.
I was just going to ask you, do people who are suffering with this end up recovering? What's the recovery rate? Or is it something that you just try to basically not make as bad in the long term? You're just trying to slow it down.
Right. It really depends on the underlying cause. I've seen people with this due to strokes who actually can have a very good recovery. The same thing with head trauma. But if it is due to a degenerative disease, it can be a slow but progressive course. And again, sometimes medications, speech therapy can sometimes help. Behavioral therapy can sometimes help. But it can be very challenging with these degenerative underlying causes.
All right, definitely sad to hear about this, and we certainly wish him the best. Dr. Mark Alberts with Hartford Hospital, thank you so much. You had a plethora of great information. We appreciate it.
Thank you.